From Bristol and Plymouth, Mr. Montigny.
Thank you, Madam President. It's rare that I find myself in disagreement with the health care chair for a variety of reasons, starting with the simple fact that he perhaps knows as much as anyone in this building about the issue, and that's a fact. It's perhaps even more rare that I find myself on the other side of the issue, particularly when he's joined by my good friend and the chair of Ways and Means. I'll say at the outset, as many have, whether it's fluff or not, that the bill is a good bill, and I know that people have worked very hard, and whether this amendment and others that I care about prevail or not, I will vote for the bill because I think it is a very good bill. But let me say why I'm taking the other side from the chairs. And again, I don't say it lightly. I chaired health care, so I always give discretion to this chair. And when I equivocate on an issue, if it's even close, my default is to be with this chair because I think he knows his work so well, and I think we owe that respect to the chairs. On the other hand, there are times when we are here for different reasons, and it is important that even in disagreement that we, in the end, come together in support of the general concept. The chair of Ways and Means mentioned early on, first, do no harm, and I think that's a great quote. It's often used when we debate health care. We all understand that oath. But that oath does not apply to industry, whether it employs 200,000 here or not. A good, important thing. Everyone in this room has somebody that they know that earns a paycheck working in that industry. So I'm not in any way diminishing the importance of the industry. But the harm we need to avoid is to the patient, because at the end of the day, it is only an industry as a result of the fact that it is a life-saving service. And there's no alternative when people show up to be cared for, which, frankly, is one of the reasons why I would not vote for this if the gentleman had offered an amendment to implement single payer. I'm pessimistic about whether it would work on a state level, frankly. After years of chairing health care, years of chairing Ways and Means and finding out how painfully expensive it is to pay for the expansions that I and others have advanced, I also spent many years of my life paying attention almost obsessively to markets. And anyone who believes, and I don't really believe people do, I think they get up in the passion in the debate, so I'll provide a caveat. I don't believe anyone in this room actually believes, if they think through, that health care in this state is in fact a market-driven industry. It may very well have some elements that are molded and shaped by the markets, but if in fact it were simply subject to the harshness of the market, many of the businesses that are here today to view and influence and lobby on this bill wouldn't exist, because industries that pay their executives $16 million as they're flying out the door don't survive in harsh markets. Industries that come in out of one side of their mouth and say, we're here to save lives, and out of the other side say, but we need $1 billion carve-out over the years, don't survive in harsh markets without those kind of subsidies. I'm not making a judgment whether that's good or bad. The body already made that decision. What I'm simply saying is that we as a government in this nation, and particularly in this state, have chosen to regulate and subsidize this life-saving service. And people who have chosen, in the private or nonprofit sector, to invest their capital in this regulated life-saving service are subjected to our rules. So there is nothing at all to be shameful about to say that we are going to compare a benchmark. And again, I want to make it very clear, I'm skeptical about whether this would work on a state level. If we were having an argument philosophically on whether it would work on a federal level or whether it works internationally or whether certain countries do better than we or don't do as well as we, different day, different debate. I've been through it many times. The chair was right suggesting that we put money aside to study. This is simply an amendment that says, my understanding of it, we will compare this benchmark, and if in fact it is comparable, we will have an implementation plan come before this body, and it will be one heck of a debate. And frankly, I don't know where I will stand. I was disappointed in the early 90s when the so-called Clinton health care plan fell apart. It only fell apart because special interests in the industry, and remember, I use that word in quotes, because it is not a market-based industry. It is, in fact, the closest thing to a cost-plus industry that we have other than when utilities were fully regulated. And I'm saying that because I think it's ironic that the same folks that come to us and say, you should subsidize prescription drugs. I helped craft the prescription drug plan. Not one person in the pharmaceutical industry came to us and said, please don't do that, because we were taking taxpayer money, like the awful Bush plan, the Medicare Part D plan in Washington. We're taking taxpayer money and we're buying your product at full retail price. And by the way, don't dare come and negotiate best prices. So we come forward, and on the one side, the industry was saying, expanding drug access is good. It saves lives and it keeps people from being hospitalized. We're all for it. Then when we came forward and said, well, you know, since we're buying so much of it, why don't we apply the market and the industry, as you folks suggest we should, and we'll buy this in bulk. Never, ever heard one merit-based argument against it, but there were a whole lot of behind-the-scenes efforts to kill any notion that this was an industry that ought to be subjected to the marketplace. So the only thing I'm suggesting, Madam President, again, particularly because I think the elements of this bill are great. As I said, I'm going to vote for the bill. I think the work of Ways and Means, the work of the chair and the staff and the President's office has been extraordinary. I'm with the bill. I'm supporting the amendment because I do believe that this industry that constantly has made the argument, when it's convenient, to leave us alone, other than when it's budget time and we are subsidizing rates for nursing homes, drugs that aren't bulk purchased, Medicaid rates for hospitals, the list goes on and on and on, and then suddenly it's not an industry anymore. It's a life-saving service that needs taxpayer money. You got to have it one way or the other. The hybrids don't work. When I wake up in the morning, just like all of you, I win or lose based on the way I place my bets, if I choose to participate in the marketplace, and I do. And some days I do well and some days I don't. The one thing I don't do is say, subsidize me for my mistakes and leave me alone when I make good money. It doesn't work that way. When you file your taxes every year as an individual, if you happen to participate in the market and you have dividends and capital gains or capital losses, your tax person adds it up and says either, good job, now pay, or you did such a lousy job, you actually get a tax benefit. The sad part about a hybrid is, especially for those of us who have worked so hard on this, I spent more years in my career helping to protect the nonprofit system in this state, aggressively opposing for-profit takeovers of the healthcare system in this state. But then a funny thing happened. What I found was that some of those folks in the nonprofit world were only operating as a charity when it was convenient, and in fact their model was very much an obsessive, successful business model. I have no problem with that, as long as they're subjected to the full harshness of the marketplace, as long as I as a shareholder get to show up at their annual meeting. In fact, if I owned J.P. Morgan stock, I'd be down there today, except for the vote here, to say to the person who runs the place, you messed up. You got to answer to a shareholder. The difference in the nonprofit world is there is no shareholder. So it is, in fact, our responsibility, whether we are saying that we need to contain the excessive pay packages, whether we are saying we need to bulk purchase drugs, whether we are saying we need to demand that nursing homes hold the bed open when someone goes to the acute care facility. It's a regulated business, and it is only an industry as it saves lives. The problem with cost control is that it's a zero-sum game. It's not access. Access means we expand and pay more, and everyone gets giddy about that if they even show up, they meaning the special interest. With cost control, there's a finite pie, and when you cut anything, you take it from someone. That's when it gets difficult, and that's why in 2006 it was very difficult to discuss it at the same time as access. I'll close with this, Madam President, because I truly believe that the majority of provisions in the bill deserve our support. I will vote for the bill. I think that if a number of amendments I care about fail, it's still a good bill, and I'm going to vote for the bill because the work of the chair particularly has been, with tremendous staff support from Ways and Means and from your office and from his office. But ultimately, if you look at first doing no harm, we've got to admit that we are already doing harm, because insurance is too expensive, and the biggest employer in Massachusetts is not the healthcare industry. The biggest employer, if you really aggregate in a macro sense, is the small business community. And they cannot, if we're going to retain an employer-based system, and the gentleman from the Cape has some interesting thoughts on that, then we must admit that we are doing harm, and ultimately decisions are made and people end up uninsured. We're lucky. We've solved a lot of that. Underinsured. We still have that problem, or paying too much for insurance. And this is never going to be easy, and I have never in my years in this body, 4 years at chairing healthcare, some years chairing insurance, 4 years chairing Ways and Means, I've never stood and said confidently that I think we can do single payer on a state level. I think even to discuss it on a federal level is exceedingly difficult. But the only reason the discussion didn't get fully vetted in the early 90s, and the only reason it didn't get done with Obamacare, is because all those folks that we refer to as an industry, that are conveniently an industry when they're coming with handout, and it switches very quickly to the other side when it affects their balance sheet or their income statement. And that's troubling, particularly when the system in this state is dominated by nonprofit charities receiving extensive benefits for that. It's disappointing because I do think that as an employer community, it's important. No, we should not do anything without careful thought that would do anything to hurt any employer in this economic climate. But the first thing we have to do is admit that right now in this climate, employers cannot pay their premiums, and the insured cannot. And even the absolute worst case, we knew that it might be harmful to the status quo, and the status quo means X employees. Even then, if you can demonstrate that it's going to save lives and deliver health care, particularly in the very real disparity in health care, and you know all the categories that are underserved, it would still be worth taking it on. And it would not be painless. But we are not in business. We used to regularly rail on the Soviet Union and say, one of the favorite anecdotes was they build planes that don't fly because they don't care about the market. They're just communists who want to keep people employed. That same argument can be made here. We are not in the business of deciding that the status quo in a regulated, subsidized business should continue. In fact, what we should do is look at it and say, what is the best model, what's in the best interest of the taxpayer, and what's the best way to serve with quality, lower-cost health care? We don't have it yet. We don't have it on a federal level. Vermont doesn't have it. We don't have it here because there's so many special interests involved, including every single patient, and that's a tough challenge. I think this bill meets many of the challenges. As I said, and I'll repeat and conclude, if this were an implementation of single payer, I'd be standing with the chair. Maybe I'd speak, maybe I wouldn't. I certainly would vote against the amendment because I don't think it is timely. But to say we'll compare a benchmark, and we may get to a point in 2015 where we present something to the legislature, that is doing no harm.